Good morning, everyone. We're going to get started in just a minute. There are a few more folks joining, so sit tight and we'll get started in a minute. Okay, well, I will go ahead and get started with our introduction as people are joining, excuse me, the webinar this morning. Good morning. We are here to talk about for our Trauma-Informed Health Department Learning Collaborative, and we're going to talk about cross-sector collaboration. My name is Laura Altman, and I'm the director of the Illinois ACEs Response Collaborative. We also have Madison Hammett, our policy analyst, who's helping to facilitate our webinar. And we are so excited to have this webinar today because we're going to hear from the Cicero Community Collaboration, and they're going to talk about the really innovative work that they're doing in Cicero. And we're also going to hear from Robin Sanger from Peace for Tarpon, and they are the first trauma-informed community in the country. So we're very honored that they're here to speak, and we're so glad you all could join us today. So we're going to start with just a couple. We are from Health and Medicine Policy Research Group, and we work to improve the health of all people in Illinois by promoting health equity. And as you probably know, there is a question box where you can submit your questions during the webinar, and we really hope you do that today. We want this to be as interactive as possible, and we welcome your questions for the speakers. So please feel free to do that throughout their presentations. We will have a Q&A at the end of each presentation. So we'll do one at the end of the Cicero folks, and then we'll do one at the very end where you can ask questions for both people. After the webinar, probably within the next week or so, you'll receive an email with a short evaluation survey, some ways to participate in the collaborative, and a recording of the webinar. So it usually takes us at least a couple days, if not a week, to get that out. So we'll get that to you. So as I said, we're from the Illinois ACEs Response Collaborative, and we are a statewide group, and we really work to break the intergenerational cycles of trauma, build resilience, and put the issues of ACEs and trauma on the forefront of the equity agenda here in Illinois. And our vision is really a resilient Illinois in which everyone has the resources and supports that they need to thrive. So in case you're not familiar with us, I'll do this very briefly. We organize our work in kind of three areas. We do policy and advocacy, and I'm excited that Illinois in May had its first Trauma-Informed Awareness Day across the state. We do capacity building with health departments, with hospitals, and other organizations, and we also do our own research, translation, and dissemination work. So this is part of our learning collaborative for health departments that are working across the state to become trauma-informed. We've been doing this work for about a year and a half, and it's funded by the Illinois Children's Healthcare Foundation. And over the last year and a half, we've engaged with about 29 exactly health departments in the state. If you're new to this, if you haven't worked with us yet, we've got an environmental scan about health departments from across the country to learn about best practices, challenges, what's going on. We recently released a trauma-informed policymaking tool, which is something you may want to use with your own elected officials. We have one-pagers, and we have had a webinar series as well for health departments. So you can find all of that on our website. And what we've learned so far from doing this work, I think when we went into this, we really thought that health departments were going to be doing a lot of internal focused work on how to become more trauma-informed internally. And we were excited to find that actually many of you all are really leading county-wide efforts. And you're really leaders in this work. There's really a variation in the extent of the work, how long it's been done in each community and county, and kind of the areas of focus. But for the most part, it's being done without a lot of resources. And we're finding and hearing that health departments you're all very creative in seeking funding for this because it's not so easy. And I know, so the focus, I know today, so that we're talking about cross-sector collaboration. So I know we have some folks joining us today who are not from health departments, and that's great because that's the topic of the webinar. So just to ground us really quickly in what we mean when we say the trauma-informed approach, as you probably know, SAMHSA says that a trauma-informed approach incorporates 4 key elements: realizing the prevalence of trauma, recognizing how trauma affects all individuals involved, responding by putting this knowledge into practice and resisting re-traumatization of community members, clients, staff. And we also often add that a trauma-informed approach also promotes resilience. And I just want to make the point that we know that becoming a trauma-informed system or community or county takes a long time. It's a continuum and a journey, and it's not something that we can accomplish right away. And we've heard from a lot of health departments that you are all doing a lot of cross-sector collaboration, or that you would like to do more. And this is really exciting because we know to truly be trauma-informed across a county, it takes a lot of stakeholders and a lot of players. We need to layer this work in housing, legal aid, health services, childcare, job training. There's so many areas that need to be involved. So I'm excited to introduce our speakers today from the Cicero Community Collaborative, which, by the way, is a Robert Wood Johnson Culture of Health community. We have two speakers joining us. Deputy Superintendent Vincent Acevez is a 2-decade veteran of the Cicero Police Department and the deputy of the Gang Crimes Tactical Unit. He's a member of the department's Wellness Committee and works with the Cicero Community Collaborative to bring trauma-informed education and practices to law enforcement professionals. And joining him will be Jackie Wallen. She is a trauma educator and the Comprehensive Community-Based Youth Services Coordinator at Youth Crossroads, which is a youth-centered, community-based organization that provides clinical services such as school-based counseling and crisis response, as well as youth development programs supporting academic success and leadership development. The Cicero community was also part of the MARC grant, which the United Way of Metropolitan Chicago received, and we were a part of as well some years ago. So they have been doing this work for some years. And I'll also go ahead and introduce Robin Sanger from Peace for Tarpon Springs. They were also a MARC grant site, so again, have been doing this work for some time. She is the founder and executive director of Peace for Tarpon Springs. She's an artist and also the former deputy mayor of Tarpon Springs, Florida. And while an elected official, Robin led the creation of the Peace for Tarpon initiative to address community violence and trauma. And the city now holds the distinction of being the first trauma-informed community in the U.S. So I'm very excited to turn it over to our speakers. We'll start with Cicero. And Jackie, I will go ahead and give you control of the screen so that you can advance the slides yourself. So 1 second.
Okay. Guys,
so great.
Can you hear me okay? Okay, fantastic. Welcome. Thanks for having us this morning. So before I talk about Cicero, I just want to let you guys know that's quite possibly the worst picture I've ever taken in my life. So I hope you guys take that into consideration. But tell you a little bit about the town of Cicero. It's an amazing community. It's predominantly working class, and we border Chicago's west side. So 3 of the most active neighborhoods of Chicago border Cicero. Cicero is about 6 square miles, and according to the most recent census, we have a population of about 85,000. Just having worked here and lived here, I'd say the population in actuality is probably closer to about 100,000. As far as our department goes, we have about 175 sworn police officers, about 25 part-time officers, 25 community service officers, and about 40 civilian support staff. We have a patrol division, a detective division, a gang division, and traffic enforcement, as well as bike teams and a couple other specialty units. As you mentioned earlier, I did manage or lead the gang unit for about 8 years. I am currently in charge. I lead the patrol division, which is all the uniformed officers. Our department deals with a high volume of calls, and some of the more prevalent calls that we deal with are disturbances, domestic violence calls, a lot of gang crime, property crimes, and most recently, over the last couple of years, we've been experiencing a lot of aggravated vehicular carjackings. We have about 22 active street gangs, which are primarily Hispanic. There's been a recent trend of historically Black gangs establishing a presence in Cicero. Most of the violent crime that we encounter, besides carjackings, as I mentioned earlier, and armed robberies, are gang shootings and gang homicides.
Yeah. So I wanted to, the purpose of this webinar is to talk a little bit about what we've been doing around trauma. And I think it's important to have some background about where all of this came from. So Vince and I had been working together as part of the Cicero Community Collaborative. We've been co-chairing what was called the Safety Committee, and had built relationships through neighborhood watch meetings and things like that. And we both read this article, which you can see on your screen, that was published in February 1st, 2017 by the Sun-Times. And what it highlighted was the high rates of police suicide amongst Chicago police. So actually, I read the article, immediately called Vince and said, hey, what are we doing to take care of our Cicero police officers? And he said, well, actually, I just printed it out and taped it to my wall because I think we really need to have some intentional conversations around taking care of officers. So at that time, I was working where I still work now, but I was doing work with youth in the community, predominantly kids involved with gangs, a lot of probation kids. So I'd been working with youth and their families who've been exposed to a lot of trauma and a lot of violence. So this started a conversation. We pitched the idea to the superintendent of police that we wanted to help support the Cicero police officers around trauma. And so what we did was we created a team. Sarah Zinn, which is a domestic violence organization in the community, myself and a school psychologist decided we were gonna just dive deep into officer wellness, community trauma, and figure out the best way to support officers. And so when we created this trauma team, we were really intentional about making sure that all of the people involved in this were personally invested in the community. We wanted this to be by the community for the community. We had no funding, so our organizations and ourselves sort of volunteered to take this on. And we were told by a lot of people, actually, that we had no business doing this. I remember I called one police officer who had been doing some trauma work in another state, and I said, this is what we're thinking about doing. Do you have any suggestions? And he said, absolutely, you should not do this. And I was caught off guard, and I said, why? And he said, police officers are not gonna listen to a bunch of touchy-feely social worker types, and they won't respond well. You need to have a police officer, you need to fly that police officer in and give this presentation. So I got off the phone with that officer. I called Vince and I said, hey, this is what they said, and I need your honest opinion, shoot straight with me. And Vince convinced me, hey, we're building laying the groundwork, we're building a solid foundation. These officers trust you. And we'll talk a little bit more about how we built that trust. And so that's where it all started. This trauma team started. So I want to talk a little bit, well, I'm going to let Vince talk a little bit more about how we got buy-in within the department.
So yeah, when you look at getting buy-in, specifically as it relates to the police department, obviously the biggest thing is you have to have some support from your top level executives. I was fortunate to be in a position where I had direct access to the chief of police. Our chief of police is a very progressive thinker, and he gave us the latitude to run with this. Sometimes in law enforcement, we can be a bit cynical, a bit untrusting of outsiders, and we're a little bit resistant to change. So you have to have people in key leadership positions that are willing to take on new challenges and that are open to change. It's critical that you make connections with those people. Every police department has that. You just have to find it.
Mm-hmm. Yeah, I think another thing that we did was I interviewed 25 officers about their experience. What were their experiences with critical incidents? What experience did they have getting support, not getting support within the department, within the community? What was their experience, helping residents through traumatic situations? What were some of the significant calls that stuck out to them as they think back on their career? And what this did was this helped us have really good relationships with the officers, those 25 that I was able to interview. And so then we were able to really tailor the presentations to Cicero. So, we talked about, there was a fire that happened in Valentine's Day a couple years back, and 8 people were killed. And so when we talk about critical incidents and we talk about fight, flight, freeze, we were able to connect it directly to situations that they had experienced. It also just allowed us to be, a credible and familiar face within the department rather than these outsiders. And then I think what was really critical is we also presented to the command staff. So this wasn't, something that we were just throwing out there that didn't have top level buy-in. And so that allowed for changes to be made based off of the information that was shared as well.
So when we talk about the logistics of this partnership and this training, it was important for us as a police department to look at a couple things that were really important. The actual scheduling, the fact that police department runs 24/7, 365 days a year with staggered day off groupings and vacations and court time. When you factor all that stuff in, it's difficult to nail down a manageable schedule for training. So that's the first consideration. The other consideration that we had to make as an organization was we had to really kind of look at what our goal was. We had to ensure that this was not a short-term Band-Aid type solution for us. We wanted to look at this as long-term, building the foundation of something that was going to yield dividends for years to come.
Mm-hmm. Yeah, and I think just recognizing that, we didn't have funding. Again, a lot of this had to be sort of worked into our jobs as it was. But we were really fortunate to have a police department that committed to training regularly. So we were able to come in and do that. This was part of their quarterly training. And actually what was really neat was we were the first outsiders that were allowed and given access to the entire department for one of their quarterly trainings. So I want to talk a little bit about what the training itself was. So it was broken up into 3 parts. So the morning, this was a full day training, and we did it in groups of about 10 to 12 officers, and it was scheduled for 3 months. And then I think we had 4 or 5 makeup sessions, again, because of scheduling conflicts. So it was pretty time consuming. But the first part of the training was, what is trauma? So officers, you would think that they have a great understanding of trauma, but when they think about trauma, they often think about physical trauma. So they think of gunshot wounds, broken bones, that sort of thing. So helping them understand the impact of trauma on mental health. We talked about fight, flight, freeze. We talk about epigenetics and ACEs and communities' response and what is normal and even healthy when they go through significant amounts of trauma. Then we moved into what is trauma-informed policing. So now, based off of this information that officers now have about the trauma and the impact on the community members, how can they use that trauma information to be better police officers? So we looked at the military police have a model called FETI, Forensic Experiential Trauma Interviewing. And so we did some role plays with them. We talked about everything from disassociation to the impact on children. And we helped them understand how they can use this trauma information to interview better witnesses, suspects, victims, children. We use personal stories, again, from the community that they would be familiar with, so they could, put this information within a framework of their own personal experience. Then we looked at trauma in the officer. So we spent a lot of time, building trust and rapport and some street cred with the officers in the morning. And then in the afternoon, we looked at how does this job impact them? We talked about vicarious trauma and PTSD. We talked about police suicide. We referenced that article in the Sun-Times. We talked about, officers that within the department and other departments that have taken their own life. And then we really focused on, okay, how do we promote resiliency? How do we help officers take care of themselves? And we broke that down into physical, emotional, relationships, and psychological. And then we looked at retirement. There's a significant spike for officers when they hit retirement where suicide rates actually go up again because of lost identity, free time, where a lot of those critical incidents start coming back. And then we talked about how that they can promote balance in their own life. So what we did with all of this information, so we did pre and post tests, and we were really fortunate to have the school psychologist. She had gotten her PhD in school psychology, but focused really on trauma. She helped us collect data. So we had pre and post data surveys that we collected, and we presented this information to the department. And this has helped us justify additional trainings and supports for the department. It helped us measure our effectiveness. And I think the really important thing was it was anonymous. So officers felt really comfortable sharing, again, their thoughts and feelings and reactions to our training.
And so when you look at some of the results from the post-training survey, if you look all the way, all the way to the right of your screen, there was an overwhelming response from our officers who indicated that they wanted additional law enforcement mental health training. Also of interest to a lot of our officers was annual mental health checkups and establishing a peer support program. And when you look at some of the violent crimes that I mentioned earlier in the community or the town of Cicero, if you look at the graph in front of you and go all the way to the left, look at 1998, moving forward for maybe approximately the next 7 years, you'll see that the shooting and homicide numbers were pretty static. Shootings were right around 65, 66 a year up until about 2005. Homicides were probably right around 8 to 10 a year. At that point, we kind of had a culture shift in our department, and we re-emphasized what we were doing. We began collaborating more extensively with the community, and I think you can see the results as you move forward. The shooting numbers decreased every year, and so did the homicide numbers. We've been able to sustain the success we've had in combating those violent crimes through our partnerships and collaborations with the community and other community-based organizations.
And this information, so the couple slides that we just showed you, as well as officers' reaction to our trainings, really helped us justify, again, further intervention and support within the police department as well as in the community. So we've been really fortunate to share this information and promote this stuff locally and actually around the country as well. But not only was this wasn't a one and done training, and that was never the intention from the get-go. We really wanted to improve police and community relationships and partnerships. And so this really propelled us over the last couple of years to do more things. So the pictures in front of you on the far left, we did a police youth summit. So we did this last December, and we're doing another one in 2 weeks, where we took youth from our community, young people of color, and police officers, and did some intentional relationship building. So we did team building activities. We did conversations around, what are some of the barriers to having good relationships between young people and police officers, and what can we do to address them? So how can we build bridges between these two groups that are often pitted against each other in media and in reality on the streets? We also have done some basketball tournaments and softball tournaments. So that middle picture's a couple officers that participated. Well, these guys watched, but there were other ones that played in a youth police basketball tournament, and I think we've done that 3 years now. And what was neat, this past year, we did it in April, we had officers from another department that wanted to be a part of this as well. And just seeing the success that we're having in bringing young people and officers together. And then in the far right is a picture actually from my son's preschool class, but we've had officers come and start to build relationships really young with officers. We recognize that children are often given messages at a really young age that, you know, if you don't eat your vegetables, the police are going to come arrest you, or things like that. So we want to build relationships from a really young age between police and youth. And what this does too is this helps police have contact with the community outside of their typical policing role. And so they're able to see the community at their best, and often at their normal. You know, police officers unfortunately only interact with the community at their very, very worst. And so they maybe see 10% of the community at their 10% worst moments. And so it's good for officers as well as community members just to see a bit more normalcy from one another as well.
So that initial training that we did on trauma-informed policing has launched us into several directions, some really great projects, and I want to tell you a little bit about some of those. So one of the first things we did based on some of the post-training survey data that we analyzed was we created a department wellness committee. And that committee is comprised of a mental health subcommittee, peer support, physical subcommittee, retirement, transition, and communication. And we all work on projects to help support our officers and help stay more closely connected to the community. And not just the officers, but the officers and their family as well. And I want to emphasize how important that is in law enforcement, because some of the stuff that we see just by the very nature of our jobs, there's a residual effect that our families endure, just you know, by virtue of the fact that they're so close to us. The other thing, a couple other things that we're working on as well as a department is a peer support program. So Jackie mentioned earlier that suicides in the Chicago area amongst law enforcement are 60% higher than anywhere else in the United States. So what are we doing about that? So we did something about it. We developed and created a peer support program for our department. It's kind of an early warning system. So we trained 13 officers and Jackie Wallen. Jackie Wallen is our clinician that's attached to our peer support program. They are trained to recognize signs and symptoms in officers that might indicate that these officers are having emotional issues or any other type of issues, so that we can intervene and get them the assistance if they so need it. It's a fantastic program. It's been very well received by the department. Additionally, based on some of the post-training survey results, we have built a department gym. We had zero budget. We took the results to the chief of police. We said, look, boss, over 90% of our employees in the Cicero Police Department want a gym. He looked at the data. He's a very visual person. He saw what the people wanted, and he gave us the permission to move forward. And we just got done building our gym, and it's fantastic. It exceeded our expectations, and we did it just through our partnerships with the community. Lots of local businesses and local donors donated to make this happen, and we're very grateful for that. We've also implemented a Handle with Care initiative. You may be familiar with that. This was something that was started by the Virginia State Police a little bit less than 10 years ago. And essentially what it is, it's just recognizing that school-age children have been exposed to trauma and trying to assist them in terms of mitigating some of that exposure. And it's as simple as this. I'll give you a practical example. I, as a police officer, respond to a domestic disturbance call. Father battered the mother. Father is going to be arrested. There are school-age children in the house who saw this incident occur. They've obviously been exposed to trauma. And so what I would do at that point is I would get the name of the child and the grade they're in. I would then notify Jackie, who is the conduit to our school system. She would then send an email to the administration of the school with just the child's name and grade with the message, handle with care. That way, if that child shows up to school the next day and is not wearing their uniform or is sleeping because the police are at their house all night, instead of taking punitive measures against the child, the teachers know to show the child some grace. And the teachers don't approach the child unless the child approaches them first and asks for help. And if that happens, we have resources that are fast-tracked to help these kids out. And then additionally, the last thing is Jackie and her crew just got done doing the second round of trauma-informed police training for our department, which kind of built on what they did initially 2 years ago. And again, it was wonderfully received by our department.
So that's all we have. I think we have some time for questions now.
Yeah, hi, this is Madison with the Collaborative. Thank you so much. It sounds like Cicero is doing some amazing work, and we're so excited to feature it. We've got a couple of questions rolling in. I wanted to get us started off with one. You talked a lot about presenting this information to, commanders and the department itself, and it seems like it was really well received there. I'm wondering though, what, if any, resistance to this idea y'all came across beyond the person who told you don't even try, but what if any resistance did y'all encounter, and how did y'all work through that, either as partners or you particularly in the police events? What were some of the issues y'all came across?
Well, I'll start, and I think that's a great question because it's practical. So law enforcement, I've never been shy about saying this. We're cynical. We don't trust outsiders. We think we know everything, and it's difficult to deal with us sometimes collectively. And so, yeah, there were people in the department, in our organization, who they were resistant to this. I think one of the steps that Jackie and her crew took to overcome those obstacles, they came in, like she had mentioned earlier, Jackie and her crew came in and met with officers prior to administering the training and did interviews with these officers. They took the results of those interviews and they tailored the training to fit some of the things, some of the feedback that they got from the officers, which was brilliant, because so now you're understanding the culture of law enforcement a little bit more. You're getting feedback from the officers and you're using that feedback to tailor the training. Things as simple as this. I mean, as funny as this sounds, we're spoiled brats sometimes as cops, and when we do training, we expect a break every hour. And I don't know what the standard is in other professions, but if cops don't get a break every hour, they start going crazy. So just little things like that. But just taking that step was brilliant on Jackie's part. And then also Jackie's kind of embedded herself with our department. Even prior to that, she's gone out on ride-alongs on every shift, not just on shifts that are convenient for her, but on shifts that are inconvenient for her as well. She's been on midnights, afternoons, and days. And she's making a connection to these officers, so they see her, they recognize her. Now, when she comes and does the training, there are a lot less barriers. So, Jackie, you want to add to that?
Yeah, I would just say, I think when it comes to police and community stuff too, police officers want to have an impact on the community in a positive way. And I think oftentimes they don't know some of the resources that are available to community members and themselves. And so I've been really fortunate to build these relationships and have officers reach out to me and say, hey, I have this family who, mom needs treatment, and what can we do to help mom get some counseling services, or this 16-year-old keeps running away. I'm at a loss. I don't want to keep arresting this family or this particular individual or whatever. Do you have any suggestions? And so what that means is fielding a lot of phone calls and being that point person. But it builds this relationship that isn't necessarily in anyone's job description, but it's just in what's the best interest of the community. And so I think that those sorts of things additionally help us build better relationships and help prove to some of those naysayers, we're going to put our actions and our money and our time and our talents, where our mouth is.
Great. That's actually a great lead into our next question, which is about the role of the city itself, the local government. What, if any, role do they have in this? Do they go out and do the same education with civilians, or is this a police-only item? What is their role in creating these partnerships?
So you're talking about are you talking about the leadership of our department, or are you talking about the leadership of our town?
of your town, it says. Yeah, the
So,
city of Cicero. So your
yeah,
mayor, for instance.
so they give us all the support and all the latitude that we need to work on and develop these projects and these collaborations and relationships, and they're active in the community. A lot of the events that we have during the warm months in Chicago, which are few and far between, are all geared towards strengthening the bond between the town of Cicero Police Department, and the community. And most of the events are geared towards family. So they're doing their part. They're doing a lot.
And are there any other specific city departments that have implemented these types of trainings with their own employees? Perhaps like housing or your health department, or is this a police-led initiative?
So this has really been actually police and school, and just for the sake of time, we didn't touch on the school aspect of things, but the school system has done amazing work around building a trauma-informed school system. So again, you can see where that Handle with Care program brings the schools and the police together, but actually we have trained all the high school district employees, from security guards, teachers, administrators, on what does it mean to be a trauma-informed school. We did a lot of survey data. We found that 98% of their freshmen, so we surveyed over 1,500 freshmen, 98% of them had experienced a significant trauma. And so we took that information again to the school and the community and said, hey, we've got to do some more stuff around supporting young people. The school added positions within the school. They've added social workers and administrators. So they've done a lot of stuff within school around trauma-informed support.
Great, thank you so much. Folks, please keep sending in your questions for Vince and Jackie. We are gonna have a larger Q&A session with the two of them plus Robin at the end. So please keep sending those in. Vince and Jackie, thank you so much. We're gonna hear from Robin now from Tarpon Springs, Florida. So thank you. I will.
Well, hello everybody. It's a pleasure to be here, and I guess I'm doing my own slides. Is that correct? Let's see if that works. Are you there?
I see you moving around. Let's see.
Go ahead and try it again. I think you should have control now.
Okay.
Yeah.
I'll just say next slide because mine doesn't seem to be working.
Okay, that works for us.
Is that okay?
Yeah.
All right. First of all, I want to thank Vince and Jackie for their presentation. It was very eye-opening, very encouraging, and it gave me some great ideas as well. And I love the fact that y'all went ahead and started, even though you were told, don't do it, don't bother, you need this, you need that you just went ahead and did it. I totally relate to that. So as was mentioned, I'm the founding director of Peace for Tarpon, and we're the first trauma-informed community in the United States. The 4 in Peace for Tarpon is connect, inform, transform, and heal. And most of our slogans and our process is all from input of our residents and from our community partners, not just our residents, but from our Peace for Tarpon partners and so forth. Did I do that or did you do that?
You did that. So
okay, good. So I guess I've got that. So this is a community story of becoming trauma-informed and resilient. Tarpon Springs is about 24,000 people, just under. We're a working waterfront, one of the few working waterfronts in Florida, which is kind of counterintuitive, but there are not that many remaining. We have a great, the top left slide is one of our public housing units. We have a beach. We have the center right, the red brick building is our city hall. And we also have a strong Greek population. We're known as the sponge capital of the world, and we have working sponge fishermen who go out and gather sponge. We are about 17% Greek, so the bottom right is our annual Epiphany celebration. So we kind of have two cultures going on. The Greek Orthodox calendar is different from ours. So for example, we'll have what they call Greek Easter and then American Easter. And it's kind of interesting, but that's us and our city seal in the front there. Peace for Tarpon began with city government when I was on the city commission. Coming from the world of being an artist, I had no clue about social services, no clue about service. I did not know what the term service provider meant. I didn't know any of the acronyms that are used. And so it was coming from a completely different world. But I think because of that, I was able to ponder some things. And one of the things that I really pondered was Pinellas County is our county, and we're very asset rich, both in our city and in our county as far as services. And I started attending the homeless leadership board, sitting on the homeless leadership board, and different experiences that I had with the jail, with the women's program at the jail, and different things. And I started noticing that although there were so many services supporting our community, that the numbers of incidents of child abuse and child sexual abuse and domestic violence and those types of things didn't seem to be going down, homelessness. So I started wondering, what were we missing? I figured something was not in the equation, and very simply, that's when I learned about trauma, about the ACEs study, and that really opened my eyes. That light bulb went off, and I thought, you know, what if it as our community, what if everybody was looking at this through a trauma perspective and understood that to have a peaceful community, which is our goal, Peace for Tarpon, we really have to understand that unaddressed childhood trauma leads to violence in one form or another. And that's a very simple way of putting it, but that's my firm belief. I thought, what if we all looked through this as a community, had this understanding? How would we treat each other differently? What kind of change could we help foster within our community? And I love this quote: there's no power for change greater than a community discovering what it cares about. That pretty much says it all. And this is an aerial view of Tarpon Springs. We have a series of bayous within our city. We have the Anclote River that runs through our city, and of course the Gulf of Mexico. So we all see the world through a different lens, but what if we all looked through a trauma-informed lens? I think it would beg the question, is life truly random? And quite often what we hear from the media and from each other sometimes is that life is totally unpredictable. You never know what's going to happen. Anything can happen at any time, and you just better be careful and be on your toes. Well, you know, of course we have to be aware and observant of our life and what's going on around us, but I'm of the firm belief that life is not random at all, that it's extremely predictable, and in that way safe in that perspective. So when you see life through a trauma-informed lens, it is not random whatsoever. It's going to come out somewhere. So whether an individual, as the ACE study proved, because that was just about physical adult health outcomes related to childhood adverse experiences, trauma, and so forth. So basically that proved that it's going to come out in physical health, or it's entirely likely coming down to a shortened lifespan. So in an individual, of course, we know that it also comes out as emotional health. And as a family, domestic violence, child abuse, community, we see it in so many different ways manifesting in our communities. But as a state and nation, we see this violence, hate, and divisiveness. To me, all of those things are very large-scale, unaddressed trauma issues, as is the larger global issues, global trauma, war, isolation, those types of things. So as above, so below. This cannot stay hidden. It's going to happen somewhere. So as a community, if we can work together to process this, to destigmatize diagnosis and what's commonly referred to as mental illness, we can start to look at the world differently and our community differently and have different responses. So this is one of our first posters, our first social marketing posters, and we also started out completely unfunded. We had a few $1,000s from the Juvenile Welfare Board, which is our child funding agency for the county, and with that we did some a little bit of marketing materials and so forth, but we had a little short window to spend that money. So one of the things we did was this poster. This was from our marketing team, and we tried to think about how can we share kind of who we are without getting heavy into trauma and you know, ACEs and all that. What kind of would beg the question of further inquiry into who we are. And so our team came up with this series of this description of who we are. It's still pretty solid. You see at the bottom, we did not have a website. We just had Facebook. And we, of course, now we have, you know, Instagram, Facebook, all, you know, website and so on. But basically the understanding that we're all in this together, that we can offer a piece to help heal the pain of trauma. And we don't have to offer ultimate solutions, but building trust. And the Jackie and Vince who spoke earlier, it's all about relationships. It's all about trust. Have real conversations, knowing that listening without judgment is an act of love. Listening is an act of love. And of course, the very basic question, what happened, not what's wrong with you. We know something happened to someone if they're showing a trauma response. It's not what's wrong with them, something happened. So these were the series of things that we came up with. That picture is our local area, the Anclote River and some of our local shorebirds and so forth. That was taken by local photographers. And since we were unfunded as well, we came to rely heavily on community engagement, community participation. Our motto is offer the piece you can. Everyone has has a piece to offer to the solution. And we found people to be very forthcoming with this. We have brain circuits for copying behavior, but compassion and kindness are also contagious. When we're looking at life through a trauma-informed lens, we experience the world differently and we see the world differently. And I believe we're more compassionate and our responses are more with that trauma-informed lens on. We're seeing everything differently. And once our eyes are open to ACEs, trauma, and how the world looks and why the world is as it is, you can't, as they say, you can't go home again. You can't unsee what you know. It's impossible. But I see that our community is becoming more compassionate, more kind, more tolerant. And I think that those are building blocks to also to community peace, of having that level of tolerance with each other. It's all about building relationships. It takes time to build relationships. Early on, I went the usual route. I didn't know what else to do. So when I convened my first meeting, it was with the city manager and the police chief and the, you know, the heads of the mental health folks in our county-wide area and in our city, the college and so forth. But early on, I realized that it's kind of touch and go. So when we have our meetings, if the director of an agency is there who's very invested in trauma-informed community, who understands this, who's all gung-ho about it, you know, she may retire or he may retire, or people move on, and then it's a matter of re-educating, rebuilding relationships and so forth. And in our county, it's quite common for folks to move around to different agencies as well, and that's happened to us more than once. It's one of the light bulbs that also went off for me, was when someone would be regularly coming to our meeting, even though it was because of their job. They were passionate about it. They were there because they wanted to be there, but they may have been moved to a different part of the county. They may have, you know, whatever. Life happens to people and off they go. So I started thinking, well, who's going to be in our city more than anyone is going to be our residents. You know, we have multiple generations of folks living here. So building relationships with our neighbors, with our community partners, but also with our government, of course, and the other folks who are very, very engaged and strong partnerships. The library turned out to be one of our most vital partners, and we just had a meeting with the library director last week to see how we can work together more over the next year or so. So it's all about relationships, but since we're the first trauma-informed community in the United States, definitely a work in progress. You're never there, I've found. You're always working and fine-tuning and working as my understanding of how this is emerging in the world becomes makes more sense to me. I can see different responses that our teams can make, and as collectively we have different responses too, as our understanding of how this looks in the world changes, expands, and so forth. But basically, our path is very creative. I think that's why, as an artist, I'm very excited and fueled by this, because we can make it up as we go along. There's no one, we can't say, oh, we're like that trauma-informed community. We're the first one. So there's a lot of room for error, a lot of room for variables, a lot of room for creative responses, and I love it. So this is kind of speaks to that creative thinking. It's inclusive thinking. You consider the least obvious and the most likely approaches. You look for different ways to look at the problem, and it's that willingness that really changes things. I love this one. Creativity is just connecting things. When you ask a creative person how they did something, they feel a little guilty because they didn't really do it, they just saw something. So it's a way for our community partners to actively engage, because if they have a creative idea that we can support and manifest, we do, and we say go for it. So we've had some really wonderful responses and ideas from community partners, and that's how this totally grows. As an artist, I understand this, because just as sometimes you'll hear an author say the book wrote itself, or the characters wrote themselves. When I do a piece of art, when I create a piece of art, afterwards I look at it and it's like, where did that come from? I don't know. It comes from a different place, this creative source, if you will. An obvious solution can take a long time. I love this slide. So how long did it take us to figure out to put wheels on suitcases? So, this is a little lighthearted, but in looking through this trauma-informed lens, we know that there are solutions that are right in front of our eyes that are just waiting to be discovered that can help this transformation within our community happen. And there are plenty of other solutions that we haven't thought of just as powerful as putting wheels on suitcases. This is also our path is not linear. It's very fluid. As one of our partners says, we launch and then we adjust. So if we launch and it fails miserably, we'll try something else. There's no shame in that, since we're unfunded and we have broad community support. Now, we did receive the MARC grant, and that was very, very helpful. So our partners, to the 5 years prior to the MARC grant, because we're coming up on our 10th anniversary now, our first 5 years we received over $1.5 million of in-kind donations. So people were used to contributing to us however they could, not providing the whole piece of something, but as they could. So the MARC grant funding was for 2 years, and that was wonderful. Now we're unfunded again. I'm a volunteer. All of us are volunteers. So as people know that this is our MO, this is how we roll. If we have money, we're happy to pay you. And if we don't have money, then people are like, well, this is the piece I can do. So the graphic designer we work with, when we have funds, we pay her. And if not, she says, this is the piece that I can offer to Piece for Tarpon. I can't do everything, but I can do this little piece. So that's what we expect of our folks. And that's what they, I think, love to do for us. So, this is a little wonky. It says offer the piece you can. Everyone has a piece of the solution to offer. Mary Sharrow in the middle is one of our board members, and she talks of herself as she says, I'm an autodidact. She didn't go to college. She is very brilliant. She reads. She's an energy medicine practitioner and just a true visionary and a strong ally and supporter of Piece for Tarpon. She's really moved us forward, but she doesn't see herself that way. She says, I'm just a regular person. I'm just a concerned citizen. So it's this very modest interactions with our community partners that have very strong impact. And even things like community gardens, our planning department on the right-hand side. Here in Florida, often wall in our front porches and put in air conditioning. So there are no more eyes on the street. There are no more front porches where people used to sit out and talk to the neighbors and so forth. Everyone's on the devices and inside in the cool. It was 100 degrees yesterday, so I completely sympathize with that. It's hard to sit outside sometimes in Florida. But our planning department allowed the setbacks at the front of some of our neighborhoods to be reduced so people could build a new porch in front of what's called their Florida room or their old porch to try to reconnect the neighborhoods in that simple way. So there are many ways to have creative solutions to this. The person on the bottom left is Peggy Cole. She's a hairstylist. She's totally loves Peace for Tarpon. She comes to the meetings. At first, you know, she could be sitting next to the mayor or sitting next to a director of a big agency. And so it took her a while to find her voice because she's, quote, just a hairdresser. But she also knows that people disclose to her in her chair, and she wants to know what to say to them, how to respond to them. And so right now her workstation looks like a little Peace for Tarpon information kiosk. We have brochures and stickers and things that she shares far and wide. Interestingly enough, when I took this picture of Peggy, the woman sitting in the chair, and I did get permission to share this information, started the English department at Marjorie Stoneman Douglas High School, also known as Parkland, where the shooting happened on Valentine's Day a year ago. And so she has a story to tell that obviously it's these synchronicities and these connections that just seem to happen that are remarkable, and that's also makes this journey very enjoyable. And Sarah Edwards on the right-hand side is owns a fitness gym. She says that this has changed everything about how she deals with folks out in the world. That's our goal, is for everyday residents to understand that they have a professional role, but beyond that, they're human beings. Our marketing outreach team, one of the things that we did was you know, the mighty oak that is in quite often the trauma things where it'll have the oak and the roots of trauma. One of our members said, well, what if we used a local tree? What if we used our mangroves? The red mangrove is all over the place here. We have the most shoreline of any city in the county. So we kind of thought, yeah, that's great. We'll use one of our local things, local trees as our symbol, because the red mangrove is resilient. The red mangrove takes toxic salt water and transforms it into fresh water in its root system. The red mangrove rebuilds shoreline, doesn't just keep it from deteriorating. The red mangrove is a better air scrubber than terrestrial forest. The red mangrove is the nursery for all of our sea life. The more healthy our mangroves are, the more sea life we'll have. The closer the fishermen, commercial or sport fishermen, can fish closer to shore because the mangroves provide safe harbor, safe nurseries for the fish, even for our sponge. So one of our marketing team also said, well, this is a way that we can kind of brand our city as a resilient community. The red mangroves are what lasts after hurricanes. The red mangroves are powerhouses of very modest looking trees. And so we also presented to the city commission saying, look, we don't have a city tree. This is a great symbol for us. Why don't we claim the red mangrove as our city tree? So now it is officially our tree. One of the artists on our marketing team, this is the piece that she offers. She created that graphic for the red mangrove and offers it freely to the city. So now some of our neighboring communities have like Dunedin was one of our communities next door. They have oranges, for the fruit, oranges painted on their buildings. So now we're working on having this little red mangrove graphic painted on our buildings and homes, just as something beautiful, but also a way for people to say, yeah, this is us, we're resilient. Bus benches, we have a very limited budget right now, but bus benches for nonprofits is a very great way to advertise. So we have bus benches throughout town. And of course, now we have brochures, which thanks to the MARC grant, we were able to print some brochures and get some marketing things up and running. We had a year of healing in the arts and community. So we did transformational theater, we did a year to destigmatize mental illness, healing voices, about how common it is for people to have altered experiences, to hear voices, to see visions. Crazy Wise talks about, it's a film, brilliant film, talking about how when folks in indigenous cultures would see visions and hear voices, they were generally called on to be the healers and the shamans. So how can we understand that we have folks having all different types of experiences here in our community? How can we include them in our community rather than say, well, they're acting weird, you know, look the other way, pretend they're not there? Not that you have to engage with everybody who's hearing voices or speaking oddly or whatever, but just to know that they're part of our community and they're included in us. They're part of us. So that was a wonderful year that we had. And then we had a magical mangrove coloring contest to help educate our youth about what the mangrove does, a little bit of ecology lessons, but also a way for them to participate that turned into it was a great big hit throughout our community. So we have trauma champions. Other communities are following our model, although we didn't even know we had a model, but Gainesville came to see us and said, we want to be just like you. Well, they can't be just like us. They're Gainesville. And it came out of different energy. So it sounds like in Cicero, some of the champions in Cicero are the folks, Jackie and Vince, who presented. They're the champions. So see who the champions are in the community, and those are the folks that can provide that necessary leadership. So we have Peace for Gainesville. They're doing it differently than we are, but they love the Peace for, the idea that peace is the goal. Peace for the Big Bend, which is a 10-county region in the Panhandle area, the Tallahassee area of Florida. Peace for Crawford County, Pennsylvania, which is also a county-wide area with some cities about the size of Tarpon. And we're really creating a trauma-informed state. We have a lot of trauma-informed initiatives happening throughout our state, and I think that this is all working towards that end. I just heard from someone yesterday in Martin County saying that one of their city commissioners is interested in Peace for Martin County. We've been working extensively with Orlando and other areas within our state as well. So we're not asking people to be us at all. I think however anyone is doing this work is wonderful, and that's what needs to happen. Folks need to understand that this is the work that's happening. This is the work of our time. It's a public health issue. It's every community's issue, and if we're eventually going to have a peaceful world, we have to figure out how to integrate this ACEs knowledge, ACEs science, ACEs understanding into a resilient community, and yeah, conversations that we have all the time. So there are many doors. Be open to possibilities. I look at this as the many doors to healing. So it might be yoga. It might be having a conversation with a neighbor. It might be a trauma-specific therapy. It might be, you know, the Handle with Care program. These beautiful little facets that can be integrated into community are all creating many opportunities for us to have this experience of becoming eventually a healthier, happier, more resilient and peaceful community. And that's it for me.
Thank you so much, Robin. We are going to take a couple of minutes now to have questions specifically for Robin, but then we're going to open up to a larger Q&A discussion between all of our presenters. So please, if you have any, send those in the question box and we will ask them. But I wanted to get us started off with, Robin, you were in local government when you first started this, and it sounds like there was a lot of involvement on that part. Sort of an echo of a question that we asked Cicero, what is the role of the actual government now in this initiative? And, you know, how have you written it in to your community's laws or processes to become a trauma-informed community?
Well, I would say, I mean, we can have proclamations by the mayor declaring Tarpon Springs as a trauma-informed community, or by the governor, or that we're the first. And we may want to pursue those as we come on our 10th year anniversary. But our city government was engaged. I asked a friend of mine to give a presentation about ACEs and about, you know, what were all the costs, the costs, the physical costs, the monetary costs, emotional costs, all those costs to a community of not looking at this. And so the initial buy-in was from our city commission. The light bulb had gone off for me, and I saw 3 of my colleagues as the light bulbs go off for them, and I thought, we have the votes. So I asked right then for the city to become our first partner in moving this forward. So the city has a very much an open door policy for Peace for Tarpon. One of the current city commissioners comes to our meetings, and we work closely with the other commissioners, and the mayor's very supportive as well. But for example, being unfunded, the PowerPoint that you just saw was created by Judy Staley at our city hall, who is the IT person, the city manager's assistant. So she knows how to do PowerPoints. I don't. So I can use, technical skills from different people. They'll do some printing for us. They'll support the coloring contest. They'll provide the ribbons and some of the prizes or things like that. But we have our monthly meetings at City Hall in the second floor conference room, open to everyone in the city. But so they host us for different events, and it's basically as if they have an idea that they'd like us to work with them, we respond to them, and if we have an idea that we'd like to work with them, they respond to us. So it's a very comfortable give and take, and but we don't look only for the city. We also work with our local churches if we need meeting space or to have special events and so forth. With our college, St. Petersburg College, we have a campus here, the library, the the safety building. So it's basically, we don't have a building, we don't have staff, we don't have phones, but what we have is the whole city. Because to me, rather than have a single partner as the city being the guiding star, it's everybody. So we broaden this to where the city is where we work all throughout the city. And it's very much open door policy through everyone that we encounter.
Great. Thank you. And that ties into our next question. And this is related to one I had. You mentioned that you have a hairdresser or you have librarians, people who this maybe isn't part of their day-to-day jobs, but they've incorporated a role, so to speak, of being trauma-informed and helping that in the community. So how have you seen a change in the culture of Tarpon Springs in the last decade since you started on this journey, and how do average citizens in their daily lives play into that culture or are part of that culture?
Well, the average citizens play into this culture. I think that this trauma understanding and ACEs understanding is a very easy thing for people to grasp. People know what happened to them in their lives and how that's affected their lives. So one of the things we're working on is to kind of take away that barrier between our quote professional lives and our quote human lives, that we're all having this human experience, facing trauma, working to process our trauma one way or another. But people get this. It's much easier for people to understand than one might think. So we have folks all throughout the city now. A single mom with 3 kids probably can't come to all of our meetings, and we don't really expect anyone to come to all of our meetings. That's asking way too much in this busy world. We have a very simple memorandum of understanding that it's been through 4 iterations. It's on our website homepage, and it just says how I'm going to engage. If I'm a business owner, if I'm a director of an agency, if I'm a regular citizen, how will I engage with Peace for Tarpon? And it's basically, I understand about trauma. I know how it looks in the world, and I'm making a commitment to do something, either to be on one of Peace for Tarpon's committees or work with a special event if I have time, or to make this real somehow in my life, whether it's my business life, personal life, family life, whatever. So we ask people to engage at a very personal level as they feel called to engage. I can't tell someone the best way for them to interact. People come all the time and say, I want to volunteer. Well, okay, but what are you passionate about? How would you like to engage with us? So it's a very much responsive to individual needs, but it's also it's easier than you'd think to engage regular citizens in this work.
Great, yeah. And on the topic of engagement, I have one last question. For those of you who are active on ACES Connection, Robin is very prolific on there, and it's great to see all the work that you're doing down there with updates. And I saw that you have engaged colleges and public health programs, and so I'm wondering what the role of that sort of more research-y side of things has been in this initiative, and how they've assisted you as well, or how you've assisted them.
Well, we have a couple of examples. We work with St. Petersburg College. We're the provost there is very concerned with student mental health, mental wellness. So we're working we have our education team meetings at the college. So we have education leadership breakfast once a year and so forth. So that's at St. Petersburg College. We're going to be hosting a mental health day for students in the fall. But an interesting kind of and with St. Petersburg College as well, we devised a trauma awareness course. It's a certification course, no college credits, but it's a way for any community member to take this online course at their own time schedule and understand about trauma, how that looks in the world, how that might look in their world, and so forth, with videos and other things embedded in that. But on a different level, the University of Florida in Gainesville, now this is separate from Peace for Gainesville. This came out of actually one of our partners came up to us and said, I think I have the piece I can offer. And I said, what's that? And he said, it's my son-in-law. And I said, okay. And it turns out that his son-in-law is a professor at the School of Public Health, College of Public Health at University of Florida. So his name is Professor Hart. So he became engaged with us, did white papers on us, did connectivity studies, did all types of those types of more scholarly type things. But for 2 semesters, Peace for Tarpon was the subject of his master's level class in public health communications, trying to figure out how students could learn about trauma-informed communities and about what materials they might want to produce to help engage community and so forth. So I think there were 5 teams that produced podcasts and infographics and posters and different types of product that they had to produce for 2 semesters. We also went up and presented to the class, and one of those master's level students is now a doctoral student, and she designed the first graduate level course that I know of for trauma-informed college level course in the United States. So she has one on trauma and one on resiliency, 1 semester each, that was just recently launched. We also went up and recorded lectures for her class. So that's kind of 2 different levels. So some are more scholarly than others, but some are more practical. If this is a public health issue, how does a College of Public Health, how are you going to get the word out when you go into the field, basically?
Great, thank you so much. Folks, we're now going to open this up. We're going to bring Jackie and Vince back and have a little bit of a larger discussion, but please keep sending in your questions. It can be specific or for both groups. So I am going to unmute y'all. There we go. Oh, I think Jackie. Jackie, can you hear us and talk? Let's see. Got you as self-muted right now. So there we go.
Okay, we're good?
Yes, thank
All
you. Thank you again to all 3 of you. These were just great, and it's so great hearing about 2 seemingly very different communities, but who are, going on that same journey to being trauma informed. I'm going to get us started off and along that line of having different communities. Vince and Jackie, I know y'all have done trainings outside of Cicero, and you do presentations outside of Cicero, so I'm wondering, we have a couple of questions. They're specific to Chicago, but just opening it up, of if you know of any other departments or communities that are taking a law enforcement sort of guide along with this, or are other police departments that are looking to do similar work to what you've done in Cicero?
This is Vince. I'll start. So I feel like we as a police department, as an organization, are kind of at the forefront of this in our area. I know Chicago is working on some similar things, to some similar trainings. They're trying to emphasize some different things as a department that kind of fall in line with what we're doing as well. But I think just you know, based purely on the what Jackie and I are here talking about today, I think we're kind of at the forefront, and we've gotten a lot of interest and feedback from other departments, and we're hoping that this becomes the standard out here.
Mm-hmm. I will say with the officer training mandates in the state of Illinois, they've put in a line where officers have to be trained on trauma-informed policing, but there really isn't clarity around what that is required. Does it mean that at one time one presenter says trauma and that counts as trauma-informed policing training? Yeah, there's not a whole lot in the mandates about what kind of training counts as trauma-informed policing. So I think as a state we're moving more in this direction, but we're looking for, I would like to see some more clarity and yeah, sort of the standards locked in.
So, and this is related to that for you, Robin. So they, have said there's not a locked in sort of clear cut, this is what you're supposed to do. But you did mention there are other communities down there in Florida who are working on efforts similar to Peace for Tarpon. So I'm wondering, how are y'all connected beyond being underneath just the same umbrella? Do you share information? Do you share data, training?
Yes, any of our information, we're totally non-proprietary. So any of our documents that folks want to use, we encourage that they discover their own process of who they are and evolve in their own way. But if quite often folks want to use our MOU, that's fine. But to me, it's more fruitful to develop your own, look at your own MOU, and it will help you decide what's most important to you, and so on and so forth. But we also now have Peace for Minnesota, which is three counties south of us, Sarasota, Manatee, and maybe I want to say I'm forgetting the third one, Levy County. So we went down and gave a presentation to them, and we interact with them and share back and forth material. It's not just in Florida. Peace for Crawford is doing amazing work, just absolutely amazing. So they came down and gave a 2-day workshop for us, sharing all of their work and their materials. And so it's a vast sharing of resources, but it's also can be as simple as a phone call, picking up the phone, having a conversation with somebody. We're all in the same big boat kind of thing. So we feel, I think, very comfortable with each other. And it does, we've been doing a lot of work with Sarasota County, the city of Sarasota rather, lately as well. So we're cheering them on their journey. We did go down and present to their kickoff meeting, just to kind of, let folks know how a community can get engaged and how powerful that is to have community as the source of the energy of this.
Great. I know here in Illinois, so many of our members of the collaborative look to other communities across the state and take pieces of what they're doing and see what works for them. So it's great to see that's happening down in Florida as well. We have a couple of questions about getting folks. I would guess I would phrase these as the commitment question. So how do you get people to keep going with this sort of work? It's very difficult, and it's can be very time consuming and volunteer based as it is in Tarpon Springs. And so what are some of the ways that you've done first in Cicero and then in Tarpon Springs to really encourage community involvement, even if it sort of seemed like this journey might be too long?
I think in Cicero, one thing that we've tried to help others as well as ourselves see is that you really have to meet the needs of other people first. So, when we approached the police department and wanted to do these trainings, it wasn't, hey, this is the training that we think officers need to have. It was, how can we come along and support your officers? In the community, the same sort of thing. What are the needs of the community, and how can, for example, the police department meet some of those needs? So the police department has been really good about providing training for local staff at nonprofits and schools, everything from, giving talks about gangs and drugs to how to interact with the police, for different youth programs and things like that, doing how to have positive interactions with police officers when you're getting pulled over while driving or something like that, to active shooting training, and so I think just trying to make it mutually beneficial has been really important. And I think recognizing that ultimately all of our goals should be to make this community better for young people, for families. And so that has been the goal in all of this. And frankly, it ebbs and flows. Sometimes people are involved and sometimes, life happens and they have to step away. I really liked what you guys talked about in Tarpon Springs about, the single mom can't go to every single meeting. I think that's really important to have realistic expectations too for people.
Yeah, and I would echo what Jackie said. We did the same thing. We approached our police chief and said, we'd like to work with you guys. How can we support your work? How can we work together? Because he did understand that you can't arrest your way out of the the troubles of the world, that he needs community involvement. So it is a mutually beneficial thing. And then we respond to what he asked us to do, but it's an ongoing conversation, and it's like as new things emerge, you respond to those as well. So it never stops. But it's interesting. I think once folks sign the MOU, the Memorandum of Understanding, that is their commitment. We say sign a copy, we'll archive it, but then you keep a copy because you're making a commitment. It's like do what you can. We're not asking you to do something that you can't do or putting guilt on you or you have to. It's not like that at all. So we've been going on 10 years. And we have monthly forums the last Friday of every month at City Hall. We constantly have new folks coming into those meetings to see who we are, see what we're about, see how they can engage, and they're good meetings. I mean, I've been to many meetings, and it's just like, oh my God, when is this going to end? Oh no! But the Peace for Tarpon meetings, and I don't really know why that is, but it's very positive energy, very positive connections, and I think that feeds people, that brings them back. It's not, first of all, not being demanding on them and giving them some emotional positivity and support, because this work is difficult. The stories are harsh. The reality is very challenging. But there's an underlying hope, I think, that brings people to the table and keeps them there. And it's also a sense of community pride now, hopefully. Although I'm sure there's many people in Tarpon who've never heard of Peace for Tarpon. I'm sure there are. I hate to think of it, but there's no doubt, but I'm somewhat realistic. But we do get new people all the time. Sometimes it's a matter of having a cup of coffee with somebody first, getting to know them, sitting down with them, building. It's about establishing relationships, as Jackie and Vince said, and building friendships, basically. So on a community-wide basis.
Great. I want to be respectful of y'all's time, and we have about 5 minutes left, so I'm going to just do one last question for you. But folks, if you still have questions, please send them in, and I will try and get those to Vince and Jackie or Robin. So, but we had a question, and it's just specifically asking about the effects on the police, but I'd like to expand that. Has there been any effects on job performance? What ROI have y'all seen based on your programs? And since the implementation. So in Cicero, that might be like within the police department. I know, Robin, you said in Tarpon Springs that you talked about trauma-informed businesses. So what are some of the, for lack of a better word, cold hard results that might sway someone more concerned about the bottom line?
So I can start. This is Vince. So for people that are like numbers driven, Jackie had mentioned earlier that, you know, for every training we've done post-training surveys, and we've noticed that the response from our officers receiving this training, the response to some of the programs that we've implemented, all the programs that we've implemented has been overwhelmingly positive. So that's one way that we measure. Just our relationships in the community, with community members, with other organizations. We've been doing collaborating on so many wonderful projects. I think that's a valid way to measure the effects of this as well. Some of these projects and these collaborations, these events we've been doing with the community and other organizations, they've just been so fantastic, and the mood that you guys described a few minutes ago, you know, you talk about, you know, a good, positive, upbeat vibe in a meeting versus, you know, oh God, I got to get out of here. I mean, that vibe, that positive vibe, it permeates, it surrounds these events that we're involved in. And then just something from a practical standpoint, as a law enforcement professional, the response of our crime victims, you know, just understanding and being trauma informed, it makes us better police officers. We're able to build stronger cases. We're able to gain more cooperation from victims because we're able to help victims through some of the things that they've experienced. And also, you know, just when we're dealing with individuals who are behaving in a way that maybe is a manifestation of some type of trauma that they've been exposed to, we understand that more clearly. So we're not as prone or as liable to take punitive measures with people. We utilize different approaches.
And Robin, have you? Oh, go ahead.
No, I was going
Sorry.
to say that I think he's what he said is exactly so true. It's just I echo that. We when we have someone who can gather data and do that within our teams, we absolutely do that and do post presentation surveys and things like that as well. But we don't really have any in the infrastructure or staff to do a whole lot of that. So that's why occasionally a university will come in, or an intern, or you know, someone will do a study on us. But we did see the projected FBI violent crimes projection for 2020, I believe, in Tarpon Springs, and they were down significantly. I think it was a reduction of over 60 or 70%, something like that. But also crime is going down anyway. So how much of that we can relate to Peace for Tarpon, I don't know. But I'd say everything that helps. You know, every little piece of it helps, and we're all going towards that same goal. So I think the collective impact is what we're really looking for.
Great. Well, thank you so much to the three of you, both for these amazing presentations and showing off all the great work you've done, and for making it through this marathon of a presentation, taking time out of your day. Folks, if you still have questions, please feel free to reach out to me or Laura. Our contact information is on there. We'd also love it if you checked out our website for some of those resources she mentioned earlier. Follow us on Twitter. And then if you have some questions for our speakers or wanted to contact them directly, they've all very generously given out their email addresses. So thank you so much for joining us. These health department webinars are a regular feature, and so we'll see you hopefully in about 6 weeks or so for our next one. And again, thank you to all three of our speakers and everyone else for joining us.
It was a pleasure. Thank you, guys.
Thank you.
Thanks.
Have a great day, everyone.